Shiskin.
Mrs. Shiskin, hi, I'm Patrick.
Hi.
I'm going to be your nurse today, and I'm here to talk to you about why you're here and to complete just a general head-to-toe assessment. Is it okay if I come in?
Yeah.
Very well. So I'm going to go ahead and sit down with the patient, eye to eye, making proper contact, and not to look down on the patient. I want to make sure that we're doing this respectfully and that we're engaging in the patient accordingly and getting the proper information the right way. Can you tell us a little bit, well actually before I start, I already identify myself. I'll go ahead and identify the patient to make sure we have the right Mrs. Shiskin. We could have more than one on this floor, could be in the wrong room. So I'm going to come in and I'm going to also maintain privacy during this whole entire assessment. I'll have the door closed or I'll have the curtain pulled. And I will only be exposing the part of the body necessary at that time of the assessment. So okay, if I take a look at your wristband, Mr. Shiskin, I just need to make sure that we have the right Mr. Shiskin.
Okay. I should be the only one, I think. Talk to my husband about that.
So I'm going to take a look at Mrs. Shiskin's wristband. I'm going to ask her first and last name.
Megan Shiskin.
Okay, perfect. And I'll also ask her date of birth.
May 29th, 1991.
Excellent. So both of those correlate. If I have to, I will go to the medical record number for further clarification. I have properly identified our patient. And now I will go on and ask her a little bit why she's here. Also, during this entire assessment, I'm going to use proper body mechanics. Again, you don't see me standing over her, bent over. I'm going to have the bed and the chairs at working height. I'm going to make sure if I need to bend, I'll bend with my legs, not my back. Just maintaining not only safety for the patient, but for myself as well. So I'll go ahead and sit down with the patient. And before we gather our objective information, we're going to go over a little subjective information with the patient. Mrs. Shiskin, could you tell me a little bit about why you're here today, why you come to us, what kind of troubles you're having?
My throat's been hurting a little bit. My sinuses have been acting up. I think I might have like a cold or like a flu or something like that. My nose has been really runny, been coughing a lot.
Okay, well it is flu season right now, so
yes,
it's been quite prevalent. Are you currently up to date with your vaccines? Have you had a flu shot recently within the past year?
Yes, in February.
Okay,
yeah,
perfect. And all your vaccines are up to date?
Yes.
Oh, great, excellent. Very well. Do you have, is this something you get every year, or is this a new onset? You haven't had it in a few years?
Yeah, I haven't had the flu in a long time, so it's kind of sucking right now.
I'm sorry to hear that.
Yeah.
Have you had any other colds or viruses recently or in the past?
No, I have not.
Okay, do you currently have any medical conditions that we would need to know about?
No.
Okay, have you had any major surgeries recently?
No, I have not.
Okay, have you had any major diseases or surgeries in the past that we should know about? Anything all the way up from childhood to now?
I had mono previously.
You have, okay.
When I was a teen. Other than that, I haven't had any major surgeries or anything.
Okay. And what about your immediate family or close relatives? Do they have any medical history or surgeries that we should know about? Do they have any diseases or
My father
illnesses?
had cancer.
Okay.
He is recovered. He's 10 years cancer free now. Yeah, I know. My grandmother had diabetes. My dad had some high cholesterol problems.
Type 1 or type 2?
I don't know what my grandmother had. She's passed now.
Sorry to hear that.
Yeah, she passed away when I was 1, so a long time ago. But yeah.
Okay. Very good.
Mm-hmm.
Are you currently taking any medication for your symptoms right now?
Yeah, I'm taking Mucinex. It's like the cold flu thing. I take, they come in like packs of like 2, so I take.
Absolutely. It should help with your symptoms
yeah,
a little bit.
I take 2 of the daytime packs, and then I take 1 nighttime to fall asleep. They seem to be helping, so that's good.
Good, very good. Are you on any other medications for anything currently besides your flu-like symptoms? Do you take anything on a regular basis?
Yeah, I'm taking birth control, and I am also taking sertraline for anxiety.
Okay, and how often do you take the sertraline?
I take it once a day in the morning.
Okay, Very good. And what form of birth control are you using?
It's pill form?
Okay, so the once oral
Yeah,
daily.
once oral.
Perfect. Do you smoke at all?
No, I do not.
Okay, very good. Do you partake in drinking alcohol at all, socially or every so often? Or
Not often. Socially, when I go out with friends, I haven't in like 3 or 4 months, so it's very rare that I
okay, so a couple of drinks once in a while.
Yeah.
Very good. Are you on any special diet right now? What does your diet consist of? Are you a healthy eater?
I wouldn't say so, but I try
That's
to.
okay.
I
Just
don't
gather
really.
general information.
I don't really eat breakfast. Just not really hungry in the morning. If I do, it'll be cereal or yogurt or something like that.
Very good.
I do have lunch and dinner every day. Meat and potatoes kind of girl. I'll do have vegetables.
Okay.
Yeah.
Very good.
Mhm.
Excellent. So after going over some subjective information, basically information that we can only get from asking the patient, something that we can't gather or won't be able to get from our head to toe, we will then head into our head to toe. We will start our head to toe with our general assessment and vital signs. Now, the general assessment should have been done right upon walking into the door up until this point. First thing, walking into the patient's room, noticing whether the patient is in any apparent distress, is she having trouble breathing, any nasal flaring, does she look sick, does she look like she's in pain, is she grimacing at all, do I see her connected to any tubes or any wiring coming from her, is she on oxygen, does she have any chest tubes, does she have an IV, if so, where? I will then take a full set of vital signs after her general assessment. After her vital signs, we'll head into the normal head to toe. Also, throughout this entire process, from when we walked into the door, while I'm questioning her, and throughout her whole head to toe assessment, I'm going to take special notice to her thought process, whether she's speaking to me correctly, she's slurring her words a little bit, does she have a normal speech pattern, her level of vocabulary, is it age appropriate, those sort of things. We'll start off our vital signs by just telling again the patient everything that we're going to do. We're going to take her respirations, counting a full minute, an apical pulse, counting a full minute. We're going to check her blood pressure, her temperature, and her pulse oximetry, and her pain level. Mrs. Shiskin, are you currently in any pain right now?
My throat kind of hurts and I kind of have a headache.
Okay. And how would you rate your pain on a scale from 1 to 10, 1 being the least, 10 being the worst?
I'd say about a 2 or a 3.
Okay. All right, is there anything that you do that makes it worse or better?
If I take Excedrin, it makes my headache go away.
Sure.
Sometimes I'll take, well, right now I'm currently taking Halls
Okay.
to help with my throat.
I'm sure that helps.
Yeah.
Anything that makes it particularly worse?
Spicy foods,
Yeah, I can
exercise. Yeah.
Okay.
If I exert myself too much.
Is it just in your throat? Does it in your head? Does it radiate anywhere? Do you feel it anywhere else?
No, I don't. Just
Okay.
my throat, my head.
Okay, very good. I will then go ahead and proceed to take her blood pressure. If we had a cuff, we would go ahead and put the cuff on the patient at this time, blow it up accordingly, let the air leak out, noting our systolic level, and then noting our diastolic level, getting an accurate blood pressure, doing it manually, of course. And then I'm going to take a full minute apical pulse, since this is Mr. Shiskin's first time in here. We want to get a pretty accurate pulse, so we'll go ahead and listen for a minute. I will warm the diaphragm of my stethoscope up first. Mr. Shiskin, I'm just going to place this on your chest and listen for a full minute. You just try to relax and act normal, okay?
Okay.
Beautiful. And again, we're placing our stethoscope at the 5th intercostal space, midclavicular line. That's our maximum pulsation location right there. I listen for a full minute. She's got a healthy heartbeat at around 85 beats per minute, so within normal range of 60 to 100. I will then go ahead and attach a pulse ox to assess her oxygen level. I'm just going to put this on your finger. It's a pulse oxygen reading. It just tells us how much oxygen is circulating in your peripheral vascular system, okay?
Okay.
Shouldn't hurt at all. Put it on. We get an accurate reading. Then going to assess her temperature. I'll get my thermometer. Mrs. Shiskin, if you would, under your tongue, please. Okay, close your mouth. Okay, perfect. A little bit of a low-grade fever at 98.9. It's okay. Just under there. We're then going to, without the patient, unbeknownst to the patient, assess a full minute of respirations. We don't want to lead on to that. We're actively counting her respirations so that we don't get a false reading. So I'm just going to go ahead and tell her to relax. And I'm just going to watch my watch for a minute. And I'll let her know what we're doing and just count her respirations for a full minute. Mrs. Shiskin, just go ahead and relax for me. Perfect. Nice healthy respiratory rate of 14 breaths per minute, in between that 12 to 20 range there. After her vital signs, we're going to go ahead and start her head to toe. I'm going to begin this head to toe by discussing the skin, although throughout my entire section of the body, and again you can do it head to toe or a general assessment in a couple different methods. You have your head to toe working from the top down, self-explanatory, or you can do body systems such as respiratory, GI, and so on. We're going to do the head to toe, but again, I'm going to start off with the skin, and I'll also be touching on the skin for every segment that we go for. With the skin, we just want to note the texture, turgor, assessing hydration status. Of course, I'm going to have my gloves on whenever I touch the patient. Turgor, just pinching lightly, making sure it rebounds back in an appropriate, timely manner. The texture of her skin, is it dry, is it moist? I want to notice any hair patterns. Is it normal? Is it thin for her age? Okay, and so then we'll start with the head. We'll go ahead and start at the head. I'm going to gently palpate her head, just for any swollen masses, lumps, any contusions I feel. I'm going to assess for any abrasions, any deformities. There's nothing really here. She's not here for anything going on with her head, so I'm not going to poke too much. But I am going to palpate lightly and take a look. Again, then I will have her look straight at us. And I'm just going to go down, notice her eyes. While I'm at her eyes, I want to assess her pupillary response.
1 second, sorry.
No, take your time. No, it's okay. I don't want to come in this way, so you're more than welcome. If you need to take a second and cough, do your thing. I do have some water for you, just a moment.
Thank you.
You're welcome.
Thank you so much. I appreciate it.
Of course.
Whew.
If at any point in time during our assessment you need to take a quick break, by all means,
Thank
please.
you.
So again, I'm assessing Mr. Shiskin's pupillary response this time. I'm going to shine a light into your eyes. Just look straight at me.
Okay.
Very good. We have a nice brisk response. Also, while I'm looking at her eyes, I want to notice the sclera. Make sure that is nice and white. I want to look at her conjunctiva and mucosal membranes, noting that they are hopefully nice and moist and pink. Any drainage I have coming from the eyes, any swelling, anything of that such. If they're dry, any abnormalities, I want to assess accommodation. So, Mr. Shiskin, please follow the pen light all the way in. Beautiful. The eyes accommodate perfectly. Pupils are equal and reactive to light. The sizes are equal. I will then go to the side, going from her eyes to the ears. I want to just generally take a look at her ear. Do I see anything abnormal with them? Is there any drainage? Is there any swelling, lacerations? I'll take a quick peek in there. No accumulation of wax. They look normal on this side. I'll go ahead and check her other ear. Perfect, nice and clean, no drainage, no bleeding, nothing abnormal. I want to make sure that her outer canthus lines up with the top of her ears, no less low set ears. I want to notice the symmetry of her face, her nose, making sure there's no deformities there. I want to notice her nares. Make sure that they're patent. No nasal flaring right now, seems to be okay. I want to look at her mouth, look at her lips. Make sure that she has moist mucosal membrane on the outside, nothing dry there. A nice color, red. I will then ask Mrs. Shiskin to open her mouth with my tongue depressant, and I will inspect the mouth. What I'm going to be looking for is her tongue first to make sure that there's nothing abnormal there, no lacerations, no swelling, no drainage in her mouth. I want to assess her gums, make sure they're nice and pink and healthy. Mucosal membranes are nice and moist. Back of her throat, I want to notice if there's any swelling there, which we might have here. She is here for a sore throat or flu-like symptoms. Her teeth, making sure that she has all of her teeth. So go ahead, Ms. Shiskin, and open up nice and wide. Say ah for me. Very good. After we're done with her head, we'll move down to her neck. We're going to assess her trachea. Make sure it's midline, no deviation. I don't see any jugular vein distension right now. I'll gently palpate one side at a time for a carotid pulse right here. Very good. Everything looks normal here. Then we will come to her upper chest region. I'm just going to palpate lightly. No deformities. Nothing abnormal there. While we're here at the chest region, we will then go ahead and we will begin to assess lung sounds and heart sounds. When I'm assessing lung sounds and heart sounds, I'll be using both the diaphragm and the bell. The bell will be using specifically for heart sounds, noting S1, S2, any murmurs, and then we'll move on to lung sounds. Mr. Shiskin, just relax. I'm just going to be taking a listen to your heart, okay? Okay. So first we'll start at the right second intercostal space, listening for her apical heart sound. Then we'll move over to the left second intercostal space, listening for her pulmonic, or aortic, I'm sorry. Then her pulmonic at her left second intercostal space. Then we'll move down to her fifth intercostal space, or I'm sorry, fourth intercostal space, noting her tricuspid, and then her midclavicular fifth intercostal space, noting her mitral. Great. Heart sounds sound excellent. No murmurs. Identified S1, S2. We'll then go into her lung sounds. And again, there's 10 on the anterior. There's 4 on each side. And then we're going to assess 18 on the posterior. Mr. Shiskin, try not to exert yourself. We're just going to take a nice, relaxed, deep breath in and deep breath out. So we'll do 1, 2, 3, 4, 5, 6, 9, 10. And we'll move on to the side here. 1, 2, 3, 4. We'll go ahead onto the other side. Nice deep breath in. 1, 2, 3, 4. Excellent. Very good, Mr. Siskin. Go ahead and take a lean forward for me. I'm just going to assess the lung sounds in the back now. Just try and relax. Again, nice deep breaths for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Excellent job, Mrs. Shiskin. Lung sounds are clear bilaterally. Also, while I'm at the chest, I want to notice that she has equal chest rise and fall, no flailed segments at this point in time. She's not labored breathing or anything like that. After we properly assess the chest, we will then go ahead and move down to the abdomen. I'll assist Mrs. Shiskin to laying over on the bed for me, please, if you would. Very good. With the abdomen, of course, we're going to inspect first, then we'll auscultate, palpating, and then ending on percussion. So first I just want to take a look, and again, as with all parts of the body, we're just looking at the skin first, just taking a look, making sure we don't see anything abnormal, no pulsations, skin, color, making sure there's no abnormal deformities, no lacerations, nothing like that, no bruises, no swelling that I can visually see. After I visually taken a look at her entire abdomen, I will then go ahead and auscultate. We're going to start in the right lower hand quadrant and work our way clockwise. I will be listening for a full 5 minutes to see if we have the absence of bowel sounds. If not, we'll be moving forward accordingly. After I've inspected, I'm going to go ahead and take a listen. Okay, beautiful. Bowel sounds are present. We would also use the bell of our stethoscope to assess for any bruise, any risk of aneurysm or such. We will then go ahead and also at this point assess the bladder. I will look for any distensions. I'm going to lightly palpate the abdomen, the bladder region. Mrs. Shiskin, I'm just going to lightly palpate. You just tell me if you feel any pain. Again, I'm palpating for any abnormal pulsations that I feel, or any masses, any tenderness, any rigidity, or rebound tenderness. No pain anywhere, Ms. Shiskin?
No.
Perfect. Okay, and when's the last time, you can go ahead and sit up for me. When's the last time that you went ahead and used the bathroom? When's the last time you voided?
Last night.
When's the last time you peed?
Like an hour ago.
Okay, and when's the last time you did number 2?
Last night.
Okay, very well. I would also, respecting Mrs. Shiskin's privacy, assess her genitalia at this time. All right, do you have a normal menstrual cycle? Do you have any issues with that?
When I was younger, I would go like months without having a period. But,
So a little irregular?
Yeah, really irregular. And then over the past 2 years, things have gotten more regular and every month.
Okay.
It's on time.
Very well. And I would assess the genitalia for any swelling, drainage, anything abnormal as well. While I have her here on the bed, I'll ask her to lay back down for me.
Yeah.
Scoot all the way back for me. Pillow here for your comfort. After the abdomen and the genitalia, I will go ahead and assess the extremities while we're down here. Again, checking the color of the skin, the condition, any bruising I see, any ecchymosis, anything abnormal. I'm going to just lightly palpate. I will check her while I'm here for femoral pulses bilaterally, looking for a rhythm, rate, amplitude. I will then check her popliteal pulses, rhythm, rate, amplitude. And while I'm down here, I will check her dorsalis pedis and posterior tibialis. Mr. Shiskin, I'm going to do that bilaterally as well for rate, rhythm, amplitude. You go ahead and pull your feet towards you. Oh, come back to me. I'm sorry.
That's okay.
Keep your legs straight.
Oh. Okay.
And just like, yep, just like that, like a gas pedal.
Okay.
And now push towards me. Very good. I've got good strength bilaterally in her lower extremities. Go ahead and ask Mr. Shiskin to stand up for me. Nice and slow. Very good. I will then go ahead and continue to assess her extremities. I'll ask her to take a step forward. Okay, can you take your right leg and lift it away from your body and bring it back? Okay, and now with your left leg. Very good. Asking the patient to abduct and adduct her legs, making sure she's got proper strength. And I'll ask her to do the same thing with her arms. Can you lift your arms up away from your body and put them back? Very good. And can you touch each fingers to your thumbs like this? Hold them out for me. Yeah. Looking for dexterity, coordination. Very good. And can you take your fingers out here? Touch your nose for me. Coordination again. Other finger. Excellent. Very good. While I have her standing here, I'm just going to assess her extremities. Looking for anything abnormal. Again, any bruising, lightly palpating, any tenderness, swollen. I will assess her brachial pulses bilaterally at this point in time as well, assessing rate, rhythm, and amplitude. Go ahead and assess her bilateral radial pulses, rate, rhythm, and amplitude. I'm going to check her cap refill, making sure we have a nice brisk, less than 3-second refill. Beautiful. Okay, and can you squeeze my fingers? Very good. Good, nice strength. Ow, I broke my finger. Oh my goodness. Very good. Excellent, excellent. Okay, and while we have her up, I just want to take a look at your back, Mr. Siskin, if you don't mind. I want to take a look at your spine. Just want to notice her spine, whether we have any kyphosis, any scoliosis, any gross deformities of the spine. Mr. Siskin looks pretty straight and narrow right here. Good stance, good posture. I'm going to ask her to take a couple steps. You come right this way for me. Very good. And now back this way. And what I'm assessing now is Mrs. Shiskin's gait, making sure she's got good balance, one foot in front of the other. Nothing abnormal, no balance issues, coordination. When I checked her genitalia, at the same time I would also want to check her rectum with her privacy, noting anything abnormal, any lesions or swelling or drainage, anything like that. Yep. After assessing her gait, we will also make note of whether she has any visible wounds on her body. If she does have any wounds or drains, we want to see if they are covered, if they're actually taken care of. If she has any tubes or dressings or anything like that, we want to measure her wounds, length and width, any undermining, any drainage, if they look infected or not. And that is about it for our general head-to-toe assessment. Thank you very much.